Assalamu alaikum wa rahmatullahi wa barakatuhu. Peace be upon you. Bismillah ar-Rahman ar-Rahim. In the name of God, the most gracious, the most merciful. Thank you for taking the time to attend this webcast. These are difficult and extraordinary times. Based on the guidelines from our Governor Jay Inslee and the King County Public Health, we expect the situation to persist for next several weeks, if not months. As concerning as they may be, these difficult times offer opportunities for us to rise to the challenge by serving the humanity and demonstrating what our faith teaches us. Prophet Muhammad, peace be upon him, faced numerous challenges during his lifetime. Each time, he taught us to place our trust in Allah subhanahu wa ta'ala and to be of service to the humanity. That's why he is called Rahmatan lil Alameen, mercy to mankind. We decided to do this webcast for 3 reasons. These extraordinary circumstances require us to make difficult decisions. It is never easy for anybody to take decisions like canceling further obligations like Friday Jummah prayer for over 1,000 people. I want you to know we don't take these decisions easily. We have to weigh so many competing needs of the community and come up with thoughtful decisions in the best interest of the community while staying grounded to our faith traditions or fiqh. Number 2, the most important thing in our mind is whether we will continue to have Jummah or will it be cancelled. This is rightly so, since many of us have never experienced such decisions in our life. On a lighter note, on a personal level, we're worried about running out of paper towels and toilet papers. However, we have to have an equal obligation to raise above personal needs to societal needs and to those who are less fortunate than us. How many of us remember the last Uber driver who brought us home on a last trip? That's why we decided to take a comprehensive approach addressing the entire spectrum of the community needs based on the resources we have. The good news is that we have been investing in the community services for many years under MAPS MCRC, MAPS Al Sadaqa, MAPS Youth, and now we are able to leverage these channels to reach the needy. Finally, our communications since the start of the epidemic has been sporadic and very segmented. Many in the community have reached out and asked for what's happening. We need the community to know that while we have limited access to our physical facility, our outreach to the community has not changed. We have adapted to the times and circumstances, and in some cases, leveraging this as an opportunity to do more. We have come up with 4 cornerstones for how we are thinking about turning this crisis into an opportunity to serve. First is health and safety and health. Second is religious services. Third is educational services. And finally, human and financial services. I will go through each one of them in detail as to what we are doing in each of these cornerstones. First, safety and health. The guiding principle for us when dealing with health and safety is compliance with the state, county, city health guidelines, both in the letter and in the spirit. In that context, we have canceled all of our in-person events at the facility. We have minimal staff at the facility to take care of essential services. Our restaurant is open with limited services, primarily for catering. We have performed a deep cleaning of the facility. We are performing daily cleaning of high-touch surfaces like door handles. We have made hand sanitizer available and hand washing reminders posted everywhere. We are now using disposable mats for sujood, for prostration during our daily prayer. We have put notices on no handshaking or maintaining physical distancing during our salat. We've also posted a COVID-19 frequently asked question on our website. Number two, at a religious level, I wanted to let you know that our goal is to continue to provide as many of the religious and spiritual services to keep the community connected with Allah subhanahu wa ta'ala and to keep the community engaged. Now more than ever, we need the strong connection to Allah subhanahu wa ta'ala. We have canceled and will continue to cancel Jummah Friday congregational prayers until March 31st. A decision beyond that will come forth as we approach the end of March. We are doing weekly Friday afternoon lecture at 1 p.m. until 3:31. This is around the same time you will be having Jummah prayer. Many of you have taken time off from work to perform the prayers, and we want this to be a reminder to be spiritually connected. However, this is not a substitute for Jummah khutbah. You're still required to pray 4 rak'ah of dhuhr at home or place of work. We have daily prayers with very limited attendance. We are doing a number of the programs, including the Sheikh Joban's halaqah and tafsir, Muslim Experience halaqah by Brother Ala Badr online. We've also instituted a 15-minute lecture every night online at 8 p.m. starting 3/16. We are going to leverage our online channels to bring a variety of scholars, both local and national, to increase our spiritual connection to Allah subhanahu wa ta'ala and serve as a reminder in these times. From an educational perspective, we are doing our utmost to keep our services uninterrupted by going online. In many cases, this will allow you to stay connected now that you are not commuting and children are at home because the schools are closed. We hope that this will enable us, adults and children, to benefit from these services. As you can see, all of the programs, whether it is the Quran classes, the Hifz program, the Friday Quran program, the Sunday school, the Saturday Quran classes, Precious Hearts, MAPS Young Professional Quran Study, Arabic classes, and youth studies are all going online. Finally, and most importantly, we want to talk about our human and financial services. We know that this crisis and pandemic has affected many people in the community in ways that they're not able to cope up with. Therefore, it is important for us to do whatever we can to help those affected in the community. From a MAPS services perspective, through MCRC, MAPS MCRC, and MAPS Al Sadaqah, we are increasing rental and utility assistance. We are going to provide increased food assistance, including delivery to those that are needy. We will be providing checks on senior citizens. We have a program called Golden Times where we engage regularly with our senior citizens. We'll continue to stay connected and make sure that they are doing well and their needs are being met. We will provide emergency medical needs and supplies to those directly impacted by COVID-19. We are also looking into an online medical consultation service that will allow people that have medical needs to have an online consultation with experts. Expect to see more of these details in the coming days. We also have a number of MAPS tenants and staff that are impacted by this. We have a number of people that are renters whose income has been affected as a result of low attendance of the community. We will provide rent relief to those tenants. And for those hourly and full-time staff that are working reduced hours, we will continue to provide the normal wages until 3/31. So how can you communicate with us? I want to provide for you 3 resources that you can use to communicate with us. Number 1, you can go, we have created a new page on our website, mapsredmond.org/COVID-19. There is a link to this page on our on this site, on our homepage, that you can use and see all of the 4 Cornerstone services that we are offering. You have an ability to fill your request from that website. You can send email to covid19@mapsredmond.org, as well as you can use our 888 number to reach a staff that can respond to your needs. Here is a screenshot of our website where not only you have 4 cornerstones that are highlighted, in addition, there is a form where you can actually fulfill and either request a service or volunteer for a service. And finally, I want to talk to you about what is our call to action. In a famous narration, Prophet ﷺ said, "Give charity without delay, for it stands in the way of calamity." At a personal level, whenever any of us or family members fall sick, the first thing we try to do is to give sadaqah or charity. And this is no different. This is a calamity for the community. And the first thing that we need to be doing is, without delay, giving charity and pray that Allah subhanahu wa ta'ala, He lifts this calamity from us. So number 1 call to action, if you are one of them that needs an assistance, or if you know somebody who needs an assistance, ask them to reach out to our website and ask for that assistance. We will do our best. We have a full-time staff that are monitoring this to provide assistance to you. If you can help in any of these pillars because you have specific talent or you would like to volunteer, you can also sign up for your services by providing the information on the website. Next, these are times that we are doing our best, and our ability to serve the community comes through your generosity. While we may not have a physically be in the masjid to remind ourselves, these are times we should remember Allah subhanahu wa ta'ala and strengthen our connection to our faith through both worship and through charity. So we have on the website, we have a page where you can make your donations, your sadaqah or zakat for this purpose, and it will help us to perform these services. Let's not forget to seek Allah's help and mercy so that He eradicates this disease and return our life to normalcy for all of humanity. I know that as I close, I know that many of us are thinking about what will happen to Ramadan and what services we will be providing. We don't know what decisions we will make, but we will communicate to you our thought process or decisions ahead of time. At this time, I do want to remind ourselves of timeliness of a famous dua or a prayer that Prophet ﷺ has said. Allahumma barik lana fi Rajab wa Sha'ban wa ballighna wa Ramadan. O Allah, grant us the blessings in the month of Rajab and Sha'ban and make us reach the month of Ramadan. This prayer is so true today than it seems like ever it has been. We pray to Allah subhanahu wa ta'ala to bless this community and to help us to eradicate the disease. Thank you for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.